PCOS, short for Polycystic Ovary Syndrome, is a hormonal disorder that occurs in women of reproductive age. Many people think PCOS only happens if you have ovarian cysts, but that's not always true. Welcome to Bodylogic Health, your go-to channel for clear, reliable, and easy-to-understand health information. Here, we break down important topics about your body, wellness, and lifestyle so that you can make informed choices every day. Whether it's understanding common conditions, learning about nutrition, or discovering ways to improve your overall well-being, this channel is here to guide you step by step. If you're new here, make sure to subscribe and turn on notifications so you never miss a video. And don't forget to like and share our content to help others learn too. Today, we're focusing on Polycystic Ovary Syndrome, or PCOS, a condition that affects millions of women worldwide. We'll explore what it is, the symptoms, causes, risks, treatments, and lifestyle tips that can make a real difference. Polycystic Ovary Syndrome, or PCOS, affects millions of women worldwide. Yet it's still widely misunderstood. Despite the name, you don't need to have ovarian cysts to have PCOS. It's a hormonal disorder that can impact your menstrual cycle, fertility, metabolism, and overall health. Today, we'll cover everything you need to know: what PCOS is, its causes, symptoms, diagnosis, health risks, treatment options, and ways to manage it. The primary issue in PCOS is a hormonal imbalance, specifically higher levels of male hormones called androgens. This imbalance affects your menstrual cycle, ovulation, metabolism, skin, and hair. To understand this better, imagine your hormones as a finely tuned orchestra. When the androgen levels rise, it's like one instrument suddenly starts playing too loudly. It throws off the balance, and your body notices the effects in several ways, including irregular periods, acne, unwanted hair growth, and sometimes weight gain. Before we start, think about your own cycle or health. Have you noticed irregular periods, acne, or weight changes? Keep these in mind as we go along. PCOS symptoms vary widely. Two women with PCOS might not have the same signs. Here are the most common symptoms, explained. First, irregular or missed periods. Some women may have very infrequent periods, while others may have cycles that are unpredictable or heavier than usual. Irregular ovulation is the main reason behind this. Second, excess facial or body hair, hirsutism. Excess hair growth is also common, often on the face, chest, or back. Even small amounts can cause distress. High androgen levels can trigger hair growth. Some may notice just a few patches, others more significant growth. Third, acne and oily skin. Hormonal imbalance stimulates the sebaceous glands, leading to persistent acne, even in adulthood. Acne or oily skin can appear due to hormone imbalance, and standard skincare may not solve it. Fourth, hair thinning or hair loss on the scalp. Women may notice widening of the hair part or thinning at the crown. Thinning hair or hair loss is another symptom, which can affect self-esteem. Fifth, weight gain or difficulty losing weight. Many women with PCOS struggle with weight due to insulin resistance. Even small amounts of weight gain can worsen other symptoms. Weight issues are frequent. Many women notice unexplained weight gain or difficulty losing weight, especially around the abdomen. Sixth, skin changes, dark patches, especially on the neck, underarms, or groin, are common and are linked to insulin resistance. Seventh, mood and energy changes, fatigue. Low energy, anxiety, or depression can also occur. For example, Sarah, a 27-year-old teacher, noticed she was skipping periods and gaining weight despite exercising. She also had unexpected facial hair. After consulting her doctor, she learned she had PCOS. Remember, not everyone experiences all symptoms. That's why PCOS can be overlooked for years. PCOS does not have a single cause. It is multifactorial, meaning several factors can contribute to its development. But risk factors include genetics. PCOS often runs in families. Insulin resistance is another factor. High insulin triggers excess male hormones, worsening symptoms. When insulin isn't processed efficiently, extra male hormones are produced. This disrupts ovulation and causes hair growth, acne, and weight gain. Many women with PCOS have insulin resistance, meaning their bodies make more insulin to process sugar. This can lead to higher androgen levels, weight gain, and increased risk of type 2 diabetes. Genetics. PCOS can run in families. If your mother, sister, or aunt has PCOS, your risk is higher. Genetics influences hormone levels, metabolism, and how the ovaries function. Inflammation. Studies show that women with PCOS often have low-grade inflammation in their bodies, which can worsen hormone imbalance and insulin resistance. Lifestyle factors like poor diet, chronic stress, and lack of exercise may not cause PCOS directly, but they can worsen symptoms and make management more difficult. Diagnosing PCOS takes time because symptoms vary. Doctors usually combine medical history, physical examination, blood tests, and ultrasound. Medical history includes menstrual cycles, weight changes, and symptoms. Physical exams check for excess hair, acne, or skin changes. Blood tests measure hormone levels like testosterone, LH, FSH, and insulin. Ultrasound can show ovarian cysts, though cysts aren't required for diagnosis. The Rotterdam criteria is commonly used. A diagnosis requires 2 of 3 features: irregular ovulation, elevated androgens, or polycystic ovaries. Early diagnosis is essential. Proper management can prevent long-term complications. PCOS is more than irregular periods or unwanted hair growth. It increases risk for several long-term health problems. Infertility due to irregular ovulation. Type 2 diabetes. Insulin resistance raises the risk. Heart disease and high blood pressure. Hormonal imbalances and weight gain contribute. Sleep apnea, more common in women with PCOS, especially those who are overweight. Endometrial cancer, rare but possible due to irregular shedding of the uterine lining. Recognizing and managing PCOS early helps prevent these complications. Lifestyle management. Maintaining a healthy weight through diet and exercise improves hormone balance and insulin sensitivity. A mix of cardio and strength training is most effective. Medications. Birth control pills regulate periods, reduce androgens. Metformin improves insulin resistance. Other medications for acne, hair growth, or fertility issues. Fertility treatments. For women trying to conceive. Medications like Clomid or assisted reproductive technologies can help regulate ovulation and increase chances of pregnancy. Management is individualized. What works for one person may not work for another. Diet is a powerful tool for managing PCOS. Focus on whole foods, vegetables, fruits, lean proteins, and whole grains. Limit refined carbs and sugars to control insulin. Include healthy fats like avocado, nuts, and olive oil. Smaller, balanced meals stabilize energy and hormones. Exercise consistently. Manage stress through meditation or hobbies. And prioritize sleep. These lifestyle changes can significantly reduce symptoms and improve long-term health. Common PCOS myths. Only overweight women get PCOS. Anyone can have it. PCOS always causes cysts. Not true. PCOS prevents pregnancy. Many women conceive naturally or with help. Understanding the facts helps women manage PCOS effectively. PCOS affects many aspects of life, but with proper care, diet, exercise, and medical support, it can be effectively managed. If you found this video helpful, like, subscribe, and share to help others learn about PCOS. Thanks for watching Bodylogic Health, and see you in the next